Hi, this is Dalene Barton with naturalfertilityinfo.com, and I'm here today to talk to you about thyroid problems and how they may affect your fertility. Many people write into us all the time with a major question. Can I get pregnant with Hashimoto's thyroiditis or hypothyroidism or another thyroid disorder? And the answer is yes, with some planning and some definite support and a great plan with your doctor. There are a wide variety of thyroid problems, and I'm going to cover the three major ones today. And there are a variety of reasons that they can happen, and there's also a lot of signs and symptoms for thyroid issues. Those signs and symptoms are so varied and cross over to so many other kinds of health problems or even other hormonal imbalance that it's really hard and way too much to cover in this video or even anything really on this site. So I just wanted to cover the fertility signs and symptoms of thyroid problems. So the number one is infertility, of course. So if you've been struggling to get pregnant, absent period, lack of menstruation, if you have amenorrhea, low basal body temperature, hyperprolactinemia, which is elevated prolactin levels, galactorrhea, which is the flow of breast milk in the absence of pregnancy or childbirth, and this may happen with hyperprolactinemia as well. Feminization in men, so some female characteristics showing up. Lack of libido in both sexes, both males and females. Abnormal enlargement of the mammary glands in men, so actually maybe growing breasts. So let's start with hyperthyroidism. So hyperthyroidism is where the thyroid gland is producing too much thyroid hormones, and this is usually caused by inflammation of the thyroid, which is called thyroiditis. This can happen for a variety of reasons, but if left untreated, may lead to Hashimoto's thyroiditis, which we will discuss in a minute. Next we have hypothyroidism, and this is an underactive thyroid. This is where the thyroid is not making enough thyroid hormones. So hyperactive is too much overproduction of thyroid hormones, and hypo is not enough. So it's underactive, it's not producing enough thyroid hormones. Hypothyroidism happens in women more often than men, and the number one reason for the cause of hypothyroidism is iodine deficiency in the diet. So something to think about. And this leads to Hashimoto's thyroiditis. And what Hashimoto's is it is a chronic autoimmune disease. With autoimmune diseases, the body has an immune response that's essentially gone awry. So it sends cells, killer cells, to attack a foreign invader. And for some reason, in Hashimoto's, the thyroid is considered the foreign invader and is attacked by these killer cells. Over time, this destroys the thyroid gland, and the thyroid function decreases, and this leads to hypothyroidism, so where it's releasing less and less thyroid hormones. The main symptom in relation to fertility with Hashimoto's is infertility. Hashimoto's is 7 times more likely in women than in men, which is very similar to hypothyroidism, and Hashimoto's leads to hypothyroidism, so that may be why there's that relation. But it's important to look at each of these thyroid issues and plan ahead for your pregnancy. And the reason for this is because there can be some pretty severe complications for pregnancy and your baby's health if left undiagnosed or untreated and you become pregnant. So not only may this create struggles in getting pregnant and may lead to infertility, but the consequences of becoming pregnant and not treating this, or having poor treatment of a thyroid issue, could be one of the following complications. So these are severe, and I don't want to scare any of you, but we want to think about really planning ahead. So anemia. So anemia is iron deficiency. Miscarriage, preeclampsia, placental abruption, and that is where the placenta detaches from the wall of the uterus prior to a full-term birth. Postpartum hemorrhage, preterm birth, low birth weight in your baby, birth defects in your baby, thyroid problems in the baby, and possible stillbirth. So those are some pretty severe complications. So we're going to want to work to prevent those prior to even thinking about conceiving. So if you already know you have a thyroid problem, you are probably already working with your doctor on a plan, and that's really good. Having a plan supporting your body through a healthy diet, possibly with some iodine-rich foods, maybe some supplementation, adequate exercise. All of these things are going to help support your thyroid. Maybe you are going to have to take a medication as part of your plan. But you want to definitely make a plan to help you not only try to conceive, but to sustain a healthy pregnancy and to have a healthy baby if you have a thyroid issue. So let's talk about some ways to support a healthy thyroid function prior to pregnancy and possibly into pregnancy. Please do not use any of these suggestions without first consulting with your doctor, especially if you are already taking a thyroid medication. So let's just talk simply about eating a whole food, iodine-rich diet. So some great iodine-rich foods. The number one would be seaweeds, also known as sea vegetables, are very high in iodine. It's also important to note that when we speak about iodine, we want to be just sustaining and maintaining a healthy amount so that we're having a balanced level of iodine. We don't want too little or too much. If we have too much, that may lead to goiters, which we do not want either. So just having a balanced, maintained level of iodine. You can achieve this through some great foods. Raw cranberries, whole fat yogurt and raw dairy products, navy beans, potatoes with the skins left on, strawberries, and Himalayan crystal salt. Another thing is that table salt, a lot of times if you look on the label, just your basic average salt, it's often enriched with iodine, and that is also to help support proper function in our body, especially the thyroid. We carry a variety of great supplements in our natural fertility shop that help support thyroid function. One specific one is called Thyrofem, made by Botanica, and it is wonderful. It's specific, full of vitamins, minerals, and nutrients to support proper thyroid function. It also contains seaweed. Another great source of rich greens and vitamins and minerals through whole foods that contain seaweed is Fertilica Ultra Greens, which is great in fertility smoothies, can be taken daily. Fertilica Ultra Greens would not want to be continued into pregnancy. It does contain some herbs that are not for pregnancy. So another great one is maca, Maca is great for thyroid function and for supporting the entire endocrine system. It really is nourishing. It's a superfood. It's very high in nutrition. So great for the thyroid. Another one that we have is Adrenal Strength. And Adrenal Strength may not seem to make sense because you're thinking adrenal glands, thyroid gland, how are they in relation to each other? Well, if you are a person that has a lot of stress, has chronic stress, or has been exposed to a lot of environmental toxins, these can greatly impact not only your thyroid, which is very sensitive to these, but your adrenal glands. So your adrenal glands are what release adrenaline, and they can handle acute bouts of stress. That's what they're designed to do, that fight or flight response. So if we have chronic stress that is creating adrenal fatigue, this may lead to catabolism. And catabolism is the breakdown of a living organism, which is our bodies, which is destructive metabolism. So over time, the body will slow thyroid function as a protective mechanism to chronic stress and adrenal fatigue. Many natural health care practitioners will agree that in order to treat the thyroid properly, we also need to address adrenal fatigue and supporting the adrenal glands. So Adrenal Strength is a whole food supplement that is supportive of healthy stress response in the body and supportive of the adrenal glands. Adrenal fatigue can lead to thyroid issues, and it can also lead to lowered immune function and response in the body. Again, supporting those systems in our body which keep us at homeostasis, keep us balanced. So Adrenal Strength is another one to consider. Another great supplement to consider, especially if you have Hashimoto's thyroiditis, because it's an autoimmune disease, would be systemic enzymes so fertility enzyme therapy using systemic enzymes. Systemic enzymes have been proven to greatly reduce autoimmune diseases as well as reducing inflammation response. So it's going to help reduce inflammation. When we have chronic states of inflammation, like what is happening through hyperthyroidism and Hashimoto's, where there's an attack on a certain tissue and there's a constant state of inflammation, this can lead to scarring, degeneration of the tissue, and adhesion formation. Systemic enzymes have been proven to greatly reduce so inflammation, autoimmune response, and prevention of scar tissue and adhesion formation. And so that's something really important to consider as well. So the plan is, if you think you may have a thyroid problem, if you have been trying to conceive for over a year, or if you have researched any of those thyroid issues and you come up with some of the signs and symptoms, talk to your doctor about it, make a plan. If you have already been diagnosed with a thyroid problem, please make a plan now. So you're going to want to make that preconception plan. You're going to want to eat a whole food, nutrient-dense diet. You're going to want to exercise regularly, and you're going to want to work at keeping stress at bay. The thyroid and the adrenal glands, again, are very sensitive to stress. So meditation, figuring out a stress reduction plan, fertility yoga, exercise, all of these things are very important. If you have a thyroid issue and you have some tips on how you control it, and if your doctor suggests any great diet tips or supplements in combination with your thyroid medications, please let us know. If you guys have any questions in relation to thyroid issues in your fertility, please also post those questions to this video. I hope you have a wonderful day.